March is Colorectal Cancer Awareness Month, and screenings for early detection is absolutely key. Dr. John Pierce is here from Preventative Diagnostic Center to discuss the importance of early detection. Doctor, we should not put these kind of tests off, should we?
No, we absolutely shouldn't. Matter of fact, the recommendations have just been lowered in age. So the recommendation is that you start getting screened at age 45 to 75. And generally it's once every 5 years.
Early detection, of course, in every disease is so vital, but with this cancer in particular, it's a fairly high survival rate for colon cancer.
Well, absolutely. There's a lifetime risk for colon cancer in men. 1 in 23 may experience it, and 1 in 25 women. It's the fourth most commonly diagnosed cancer, and it's the second leading cause of cancer death. We've seen an increase of about 63% worldwide, which equals about 3.2 million cases annually of colon cancer.
So I'm going to talk to the audience, over the age of, say, 40 or 50 right now. There's this fun little thing called a colonoscopy. We all know about it. We all talk about it. We all share notes. You over at Preventative Diagnostic Center, you actually offer a virtual colonoscopy. Describe how this is different from a traditional procedure.
So in a way it's similar because the preparation is the same. So anybody who's had a colonoscopy understands the preparation. We got to get the bowels cleaned out first. So that part is similar. But outside of that, we do not use any anesthesia. So you don't have to be under the influence of any medication. You don't have to have anybody drive you back and forth to the appointment. You can do that on your own because it's not an uncomfortable procedure. The other thing is that we do not have a camera that is going up through your rectum and into the colon to look at everything. This is, we have to blow air into the colon. So we do put a little air in there to expand it, but then we do the scan right over that. And so you really don't have an invasive procedure. So
wow.
That makes it a lot better for people. No anesthesia. No invasiveness per se.
I think the less invasive, the better probably when it comes to this area. With your procedure though, can you explain what the advantage of this would be for certain patients? Who is this really best for?
Well, first off, it's preference, right? And what we're trying to do is lessen the fear of the colonoscopy. So it make it a little bit easier and more welcoming so we can get more people screened. And so that's kind of the main thing. But there's some things that we have to look out for. So if somebody's got a strong family history of colon cancer, probably not recommend our scan. We recommend that they actually get a true colonoscopy. If they've got a history of polyps or they have a genetic condition like hereditary non-polyposis colorectal cancer or family Adamus polyposis, these types of things, you really want to get an actual colonoscopy because they can start doing some biopsies and things of that nature. But in general, for screening, if you don't have a strong family history and you don't have a personal history, this is a great screening tool. You know
what, doctor, that makes a lot of sense. You have really a fantastic thing going on over there at Preventative Diagnostic Center. If people would like to reach out and learn more about this particular scan and the other scans you offer, they can do that. The website, the phone number is going to be up on the screen here. Oh, it's up on the screen right now. There you go. You also have a special offer for us today, which I know our viewers really appreciate.
Yeah, what we're doing is better than a 2-for-1 on the heart scan. So generally we charge $5.99 for one heart scan. We're offering 2 scans for you and your partner for $125.
Excellent. Dr. John Pierce, always a pleasure to talk to you. So much has been shared between you and I today. I feel like we're just a little bit closer after talking about this. Take care, doctor. For more information, visit pdcenterlv.com. The phone number right there on your screen.